This is an audiovisual representation of a study published in the Journal of Bone and Joint Surgery in 2025. End-stage ankle arthritis is a degenerative joint disorder that causes severe pain and significantly impacts a patient's quality of life. Surgical treatment options include ankle arthrodesis, or AA, and total ankle replacement, or TAR. While multiple studies have compared the clinical and patient-reported outcomes of AA and TAR, their findings are often limited by low-quality evidence and short follow-up periods. To assess the long-term clinical outcomes of TAR and AA, researchers conducted a prospective multicenter study. They analyzed data from 211 patients with end-stage ankle arthritis who underwent TAR or AA between 2001 and 2007. Sourced from the Canadian Orthopaedic Foot and Ankle Society Prospective Ankle Reconstruction Database. Clinical outcomes were compared using validated scoring instruments, including the Ankle Osteoarthritis Scale and short-form 36 scores. The analysis revealed a mean follow-up period of 13.2 years. Mean age, smoking status, and arthritis diagnosis differed significantly between patients who underwent AA and those who underwent TAR. The likelihood of requiring no additional surgery after the initial procedure was higher in the AA group than in the TAR group. However, functional outcomes were similar between both groups. Overall, the long-term clinical outcomes of AA and TAR were comparable, suggesting that the choice of treatment should be tailored to the patient's specific clinical condition.